Here is a combined summary of the 2 pages. The authors propose a survival analysis model for predicting time to total knee replacement (TKR) surgery, utilizing features from medical images and clinical measurements. They employ supervised and self-supervised deep learning approaches to extract features from radiographs and magnetic resonance images. These features are combined with clinical and image assessments for survival analysis using random survival forests. The model demonstrates high discrimination power, achieving an accuracy of 75.6% and a C-index of 84.8% for predicting time to TKR surgery. Knee osteoarthritis, KOA, is a prevalent joint disease, affecting millions worldwide and resulting in physical disability. Total knee replacement surgery emerges as a plausible intervention during advanced disease stages. Predicting time to TKR is essential for identifying patients at higher risk of rapid KOA progression and offering prognostic guidance. Radiography and magnetic resonance imaging (MRI) are the most commonly employed techniques for evaluating KOA. Features on radiographs and MRI scans, coupled with quantitative and semi-quantitative assessments of imaging, have demonstrated associations with KOA progression, including an elevated risk for TKR. The authors introduce a multimodal approach that utilizes right-sensor data, clinical variables, quantitative and qualitative measurements from radiographs and MRIs, as well as deep learning features extracted from these modalities to predict the time to TKR over a 9-year follow-up period. They hypothesize that integrating clinical variables, quantitative and semi-quantitative assessments from radiographs and MRIs, and deep learning features into survival models will result in more accurate estimates of time to TKR compared to models using only deep learning features. The study utilizes the Osteoarthritis Initiative (OAI) publicly accessible database, which contains clinical variables, radiographs, MRI exams, and radiograph and MRI quantitative and semi-quantitative image assessment measurements for 4,796 subjects aged 45 to 79 with or at risk for KOA. Out of these subjects, 547 underwent TKR during the 9-year follow-up period. The authors use both knees of the same patients as separate data points to enhance model robustness. The research focuses on estimating the time to total knee replacement surgery using a machine learning approach. The study utilizes the Osteoarthritis Initiative (OAI) database, which contains clinical, radiographic, and MRI data from 4,796 subjects. The dataset is filtered to include 1681 knees with complete clinical variables, radiograph, and MRI quantitative and semi-quantitative image assessment measurements. The dataset is partitioned into 1239 training, 172 validation, and 270 test data at the subject level to ensure consistency. The study cohort identification is summarized in Figure 1, and the details of the data splits are presented in Table 1. The baseline gender and age of subjects in the OAI study cohort are also provided. The proposed approach involves a multimodal feature extraction framework, which combines clinical variables, radiograph, and MRI measurements. The framework consists of feature extraction using self-supervised pre-training, feature selection, and survival analysis. Self-supervised pre-training is performed using the Twin Class Distribution Estimation (TWIST) framework, which extracts representative features from in-labeled 3D knee MR images. 2 separate 3D ResNet 18 models are trained on the ZE and DES MRI sequences using the TWIST framework. The feature extraction process involves concatenating the extracted features from radiographs and MRI measurements. The concatenated features are then used for survival analysis using the Random Survival Forest (RSF) model, which estimates the time to TKR. The hyperparameters of the RSF model are tuned using Bayesian optimization. The predicted survival probabilities are calculated using the Cox model. The flowchart of the proposed approach is presented in Figure 2, which illustrates the multimodal feature extraction framework, self-supervised pre-training, feature selection, and survival analysis. The study aims to develop a robust and accurate model for estimating the time to TKR, which can facilitate early intervention and personalized treatment plans for patients with osteoarthritis. Here is a combined summary of the 2 pages. The research focuses on estimating time to total knee replacement (TKR) surgery using deep learning, DL, models and clinical variables. Two separate 3D ResNet-18 models were trained using Zhe and Des MRI sequences, and a 2D ResNet-18 model was trained using radiographs. The models were trained using the Kullback-Leibler divergence loss, ensuring the output distribution resembled the normal distribution of the labels. The best model for each MRI sequence was selected based on the highest accuracy achieved on the validation data. Features were extracted from the output of the last pooling layer, and a least absolute shrinkage and selection operator, lasso, method was applied to the Cox regression model for feature selection. A random survival forest, RSF, model was used for time-to-TKR prediction, incorporating the extracted features and clinical variables. The RSF model's output consisted of predicted survival probabilities, indicating the likelihood of not undergoing TKR surgery for each subject over a 9-year period. The proposed model's performance was compared to existing literature using the Wilcoxon-Sindrank test. The results, presented in Table 2, show that the RSF model utilizing self-supervised DL model features extracted from the Des and Zhe MRI sequences exhibited comparable accuracy but achieved a superior C-index compared to the RSF model using pre-trained MED3DDL model features. The RSF model with self-supervised DL model features extracted from radiographs and the Des and Zhe MRI sequences improved the accuracy of time-to-TKR estimation. The RSF model with Lasso-Cox feature selection method combining clinical variables, radiograph and MRI quantitative and semi-quantitative image assessment measurements, and the concatenated self-supervised DL model features extracted from the Des and Zhe sequences and ImageNet pre-trained DL model features extracted from radiographs had the highest estimation accuracy and C-index for predicting time to TKR. The confusion matrices for plus or minus 1 year estimation are shown in Fig. 3. The study demonstrates the effectiveness of integrating DL models with clinical variables and image assessment measurements for time to TKR estimation. The proposed model's superior performance suggests its potential for clinical applications. However, limitations and assumptions, such as the use of a normal distribution for label mapping and the imputation of missing values, should be considered in future work. Here is the combined summary of pages 7 and 8 of the research paper. The estimation of time to total knee replacement, TKR, surgery is presented, with a focus on the performance comparison of various models. Figure 3 displays the confusion matrices for plus or minus 1 year estimation using two models. A self-supervised model incorporating Des, Zhe, X-ray, clinical, and measurement data, and a supervised model utilizing Des, Zhe, X-ray, clinical, and measurement data from subjects who underwent TKR in 9 years. The self-supervised model outperforms the supervised model. Table 3 compares the performance of existing methods using the subject cohort from this paper. The proposed model achieves an accuracy of 75.6% and a concordance index of 84.8%, outperforming existing methods. The number of features used in the original studies varies due to missing values and identical enrollment variables across all visits. An ablation study is conducted to analyze the performance of utilizing clinical variables, radiographic and MRI assessments, deep learning, DL, features, and their combinations using the Cox proportional hazards model, discrete time generalized linear model, GLM, and random survival forest, RSF, model. The RSF model yields the most favorable results. Table 4 presents the performance of using different models for predicting time to TKR. The integration of various clinical variables, radiographic and MRI assessments, and DL features extracted from these imaging modalities into predictive models results in superior accuracy in estimating time to TKR compared to models analyzing DL features individually. The most effective model utilizes the whole study cohort with 113 relevant clinical variables, radiographic and MRI assessments, and self-supervised DL model features trained on data from these modalities. The study demonstrates that incorporating clinical variables, radiographic and MRI assessments, and DL features into predictive models results in superior accuracy in estimating time to TKR compared to models analyzing DL features individually. The use of right-censored data may help capture the entire distribution of time to TKR within the study cohort and enhance the model's generalizability. However, the model's generalizability to more diverse subject populations needs to be further investigated, and the decision to undergo TKR can be affected by multiple factors not available in the OAI databases. Accurately predicting the time to total knee replacement (TKR) surgery remains a challenging task due to various factors associated with the surgery decision. The use of an ensemble model for survival analysis, incorporating clinical variables, image assessment measurements, and MRI sequence as well as radiograph features extracted from unsupervised trained deep learning (DL) models, has shown promise in estimating the time to TKR. Several studies have explored the application of machine learning models for predicting TKR. For instance, Adeo et al. Compared time-to-event machine learning models in predicting oral cavity cancer prognosis. Similarly, Hedayati et al. Estimated time to TKR using deep learning. Other studies have utilized DL models for predicting progression in knee osteoarthritis, OA, using multimodal magnetic resonance images from the Osteoarthritis Initiative. The development of criteria for the classification and reporting of OA has been a crucial step in understanding the disease. Altman et al. Developed criteria for the classification and reporting of OA, including the classification of OA of the knee. Moreover, Chen et al. Introduced MED3D, a transfer learning approach for 3D medical image analysis. Various researchers have employed artificial neural networks to predict TKR from symptomology and radiographic structural change. Heisinger et al. Used artificial neural networks to predict TKR from symptomology and radiographic structural change using data from the Osteoarthritis Initiative. Additionally, Jamshidi et al. Developed a machine learning-based individualized survival prediction model for TKR in OA. The Osteoarthritis Initiative has been a valuable resource for OA research, providing data for numerous studies. Liu et al. Predicted TKR and diagnosed OA using deep learning on knee radiographs, while Liang et al. Predicted TKR and diagnosed OA using deep learning on knee MRI. Other studies have utilized data from the Osteoarthritis Initiative to develop prediction models for TKR. The use of DL models has also been explored for predicting knee OA progression from structural MRI. Panfilov et al. Predicted knee OA progression from structural MRI using deep learning, while Tolpady et al. Predicted TKR from magnetic resonance images using deep learning. Overall, the studies highlighted in this paper demonstrate the potential of machine learning and DL models in predicting TKR and diagnosing OA. However, further research is necessary to address the limitations and assumptions of these models and to explore their clinical applicability. The authors propose a deep learning framework for estimating time to total knee replacement surgery based on preoperative magnetic resonance imaging (MRI) scans. This task is formulated as a regression problem, where the goal is to predict the time interval between the MRI scan and the subsequent total knee replacement surgery. The proposed framework consists of two stages: feature extraction and time-to-event prediction. In the first stage, a convolutional neural network (CNN) is employed to extract relevant features from the MRI scans. Specifically, the authors utilize a ResNet-50 architecture, pre-trained on ImageNet, as the feature extractor. The extracted features are then fed into a fully connected neural network (FCN) to predict the time to event. To address the issue of censored data, where the exact time of surgery is unknown for some patients, the authors employ a censored regression loss function. This loss function is a modified version of the mean squared error (MSE) loss, which takes into account the censoring mechanism. The authors also explore the use of transfer learning and knowledge distillation to regularize the model and improve its performance. The proposed framework is evaluated on a dataset of 200 patients, with MRI scans and corresponding time to surgery information. The results demonstrate that the proposed method outperforms several baseline models, including a traditional machine learning approach using handcrafted features. The authors also provide an ablation study to investigate the impact of different components of the proposed framework on its performance. The paper also reviews relevant literature on deep learning-based methods for medical image analysis, including breast cancer grading and survival analysis, as well as brain age prediction via gated knowledge distillation. These references highlight the growing interest in applying deep learning techniques to various medical imaging applications.